All right, we're back. Another episode of The Climb. Here today by myself, and I wanted to talk to everyone about self awareness. I want to share what it means to me and why it's so important for everyone. And additionally, to finish out with, how people can start building their own self awareness for their health, for their mental health, physical health, spiritual, however you want to look at it. So, without being obvious, a lot of people have heard me talk about my life living with bipolar disorder, but I'm also diagnosed with ADHD. And over recent, I had to really reflect on, how I was utilizing, certain remedies for my ADHD and, how that incorporated with my bipolar disorder. And it took a lot of self-reflection over the past couple months to really understand where I needed areas of improvement in my life and where that stemmed from. And without having a strong self-awareness of my own self, how I feel, how I process things, and also how I emotionally and physically react to certain things, made it easier. And the reason why that is, so important to me is because I do have, a bipolar disorder. I do deal with ADHD. I have a hard time sometimes with my emotions. And although I do a good job of processing them, sometimes they run amok on their own. And being aware of myself and how I feel and how things are affecting me have really helped me, steer the ship. You're not always going to be rainbows and sunshine, but when you have an opportunity to reflect within yourself and understand who you are and how you react to things and how things should be in your light, it's very helpful. And why it's so important to me is I have had really tough times in the past with my manic episodes, to the point where everyone thinks it's just normal AJ. And to be quite honest, it's challenging to really see this switch in between everyday person AJ, who's a high achiever, has a lot on his plate, he's energetic, he's friendly, he's outgoing, to slightly manic AJ. And a lot of people that are bipolar or know people that are bipolar and have had manic episodes, it is really a fine line of, hey, I'm just a little bit more intense in all of these different situations. But it starts out as you're almost feeling better, you're almost performing better, you're almost doing better. So keeping a pulse of myself is extremely important. It's not that I wasn't completely aware of my surroundings and like a light switch, I was completely manic, but it got to certain points where there was no point of return, that I was off the rails and I was going in a direction with my mood and my energy that really was not going to be stopped without medical intervention. And I could proudly say, we're coming up on almost 5 years with me being, I believe, 4 years of me being out of the hospital for the longest period of time. And a lot of that is attributed to my awareness to diagnose myself with my own self-awareness and being open with myself of how I'm actually doing in the present moment. And so that's really important for not only me, but for everyone, to reflect on yourself and to understand what is your true baseline. And hey, I'm out of the norm right now. Maybe I'm being triggered by something. Maybe something's upsetting me in life. And that can carry with you with the emotions or negativity or, just some hardship of not realizing that, hey, maybe this is just a bad time that I'm having right now. And, there's better days to come. And I think it's really important, not only for people like myself, but everyone, to have a barometer on their own self, to understand, hey, at this moment in time, I know I'm not myself. I've been pushed to my limits with my emotions, with maybe my physical abilities, and understand that, hey, I maybe need to dial it back, or maybe I need to supplement it with this type of routine. And Where that's come into play the past 4 years for myself has been, avoiding these manic episodes. I have probably had on paper more stressful times these past 4 years than I had ever since I was diagnosed with bipolar disorder. Buying a house, getting married, job changes, financial, hardships, good parts of financial, you name it, just being an adult and young adult and dealing with the ups and downs of that. And I have dealt with that differently because I've been so aware. I attribute a lot of it to my relationship with my psychiatrist, as well as, my therapist over time. And the reason why I like to really bring that up is because all of these times when, I've maybe been hospitalized because of my manic episode, there was points of intervention that maybe I was still aware that something needed to be done, but not fully committed. And I didn't want to put myself in that situation. I don't want to put myself in that situation ever again. So what I've done is I've stayed extremely consistent with myself and that barometer. And the way I kind of established that was working with a doctor and talking with my doctor saying, hey, listen, here's what happens when, I kind of go off the rails. Here's what happens. And at every point we try to get, myself and my family, my loved ones are trying to get me help, trying to actually get me, some medicine to knock me out, to get me more sleep, to really de-escalate this, manic episode. What do I do? And he prescribed a medicine that he would prescribe to me and said, use it as needed. Came to a point right before Christina and I moved into our first home, and I had a lot of things going on with work, and I talk about, this in some of my blogs in the past and have mentioned it here. I was like swimming in shark-infested waters. I just had so much stress going on to the point where Christina and I started to both notice some symptoms, maybe not full mania, but hey, we're about to get on a roller coaster here. Maybe we reach out to the doctor and see what he has to say. And I ended up taking, a medicine to help me out to level myself out. Even though I wasn't really close to a manic episode, I was aware of, hey, I know how these steps go. I know how they're very slippery, and at any point, it could really take off. And, since that moment, I've been extremely present with myself to the point where after talking with my doctor, after the situation dissolved, he said, hey, listen, find a rating to what you felt in that moment. And if you ever get to that point again, or you get over that, he said, rate it 1 out of 10. If you get over that or to that point, you know what to do. And so for the very, very first time, I was able to put, like I said, this barometer on my mood and understand that, like, hey, I can't get to a 4. 4 is not a manic episode. And quite frankly, it might have not even gotten to that point. But I understood that, hey, if I get to that point, it means I feel like I'm close. And if I feel like I'm close, then I should be supplementing with something just to level me out. Really weird for me to be excited to announce, but like I've used that strategy multiple times, a handful of times. Maybe taking this supplemental medication, which to be honest is also prescribed to people like myself on a routine basis, so it's not harmful. But I've taken these measures of caution a handful of times in a lot of stressful moments, and it's really helped me. But I got there from my own self-awareness and getting to really understand, hey, at what point am I going to make an action? Hey, at what point am I feeling, a certain way where I need to maybe reach out for help? But it's not necessarily about the external exchanges. I mean, of course it is. Like, you want to take and get help when you need help, but it's having that internal conversation with yourself and knowing, hey, I'm in control of things. I'm okay. I know that something is going on right now. I'm not going to ignore it. I'm just going to take advantage of it. And yeah, it's almost like having a little bit of vulnerability, but that's almost the biggest strength you can have, is recognizing that, like, I am not in the best spot, but I'm aware of it. And you know what? I'm going to get in front of it right now. This has been so helpful for me. not only just for myself and my own process, but how I communicate to other people. I communicate with Christina all the time. I even say, hey, I'm like a 0 on the scale, but I'm on the scale. And, a lot of people might think, okay, that doesn't mean anything. But for our communication's sake, my normal AJ is not doesn't have a barometer for mania. He's stable. But if I say, hey, I'm a 0, but I'm on the scale, it's like, hey, let's watch out together. I want to communicate this because, not only do I want you to know, but I want to have this empowerment that I am in control of my own destiny. And it's really helped out. So, although that was a lot of information on how I've kind of processed things with my mania, it comes the same length of how I deal with my own ADHD and everything that, comes in byproduct of, having a mental illness like anxiety and depression. I can understand a little bit better into my own self of, hey, I know this is just a moment in time that's not really good. Or maybe, hey, maybe I'm like just being really, really hard on myself. For years, I've powered through perceived flaws and masked it with achievement. And although that was a recipe for success for a younger AJ, once I was tackled with this diagnosis and life drastically changed for me, it made me realize that, some of the biggest and strongest things you could do is be vulnerable. And in order to really be aware of your own self, it's opening yourself up to that vulnerability and being okay with it. It's almost exciting to know that I can, certainly rate out my mood and actually understand where I currently stand and know what actions to take. And for anyone that's been around me, it's been really tough, in those really, really stressful times. It's hard to approach someone that's maybe on the brink of a crisis or just in general struggling. So I find a lot of this empowering that I can be the one to break the news to my friends, to my families, to my loved ones, and be, hey, I'm not doing really well right now. Here's what I have going on. Here's what I'm doing to fix it. But I wanted to let you know, rather than someone telling me, AJ, you're not doing so well. So I want everyone to take that in. I think it's really important just to be self-aware and reflective. It's really important for everyone to be aware of mental health as a whole. And that awareness is so strong. But we have to internalize it as well. And we have to be okay with it. It's okay to be not okay. And you have to be the first person to believe that. And holding yourself accountable with this self-awareness is really one of the more healthier things you could do. All right, everyone. I hope everyone enjoyed that. Trying to make sure that everyone gets a glimpse of not only my life, but just some remedies that I do for my own self. This was extremely relevant the past couple months, and I'm glad to share it with you. So thank you, everyone, for watching and for the continuous support.